I think a company doctor should pass the problem on to the experts. The role is a fine balance between the employee and the company or the manager. You have a duty of care to the employee, and you have to provide advice to the manager to how to deal with sometimes very complex medical cases. And alcohol and drug problems I would put in one of the highest categories of medical problems. I think a lot of company doctors or occupational health professionals leave it up to the GP. The GP has the local alcohol and drug teams, which in some areas are very good. Other areas, from what I've heard, I'm concerned about what support they can provide. And if you're dealing with addiction specialists, they are a very rare breed. From a subspecialty in psychiatry, addiction specialists are very few and far between. The most important thing is follow the substance abuse or alcohol and drug policy, and then leave it to the professionals. I think that is so important. Too often I've seen managers dealing with these issues, thinking they can manage them themselves, and they ultimately end up the victim. By the professionals, I mean people who are trained in dealing with alcohol and drug problems. And there are not very many around, unfortunately, but it is important to get the right people assessing the individual, the degree of their addiction, and then channeling them into the right type of treatment. Alcohol and drug problems are a medical problem. They need to be dealt with as a medical problem, and that individuals need to feel safe to come forward and say that they have a problem and they need help. And if you have that in the organisation, you start moving the issues forward and you start addressing the issues.